Today we're going to talk about grooming, bathing, and dressing. This information can be found in chapters 23, 24, 25, and 26 of your textbook. So just an overview and review of the teeth and gums. The teeth cut, chop, and grind food into small pieces for digestion and swallowing. The three main parts of a tooth are the crown, neck, and root. The crown is the outer part of the tooth. It's covered by enamel. The neck is surrounded by the gums, and the root fits into the bone of the lower or upper jaw. With age, primary teeth or baby teeth are replaced by permanent teeth or adult teeth. Normally, adults have 32 permanent teeth. Illness, disease, and medications often cause a bad taste in the mouth, a white coating in the mouth and on the tongue, redness and swelling in the mouth and on the tongue, and dry mouth. This is a picture of a structure of the tooth. The dentin is the part of the tooth beneath the enamel. It contains microscopic tubules or small hollow tubes. When dentin loses its protective covering, the enamel, the tubules allow heat or cold or acid or sticky foods to stimulate the nerves inside the tooth, causing sensitivity. Hygiene involves cleanliness practices that promote health and prevent disease. Oral hygiene or mouth care are the practices that promote healthy tissues and structures of the mouth. Oral hygiene keeps the mouth and teeth clean. It prevents mouth odors and infections. It increases comfort. It makes food taste better. It reduces the risk for cavities. Oral hygiene reduces the risk of periodontal disease and prevents plaque and tartar buildup. Periodontal disease refers to an inflammation of tissues around the teeth. Plaque is a thin film that sticks to the teeth. It contains saliva, microbes, and other substances. Plaque causes tooth decay. Hardened plaque is called tartar. Tartar builds up at the gum line near the neck of the tooth. Tartar buildup causes periodontal disease. With this, the gums are red, swollen, and bleed easily. Bone is destroyed and teeth loosen. Tooth loss is common. Here are some terms related to oral hygiene. Periodontal disease is disease of the gums. Plaque is a sticky, colorless deposit that forms on the teeth. It develops when carbohydrates are left on the teeth. Bacteria live in plaque and destroy the tooth enamel, causing tooth decay. Plaque left on the teeth for more than 24 hours turns into tartar. Tartar promotes tooth decay, gum disease, and gingivitis. Gingivitis is inflammation of the gums caused by bacteria and plaque that remain on the teeth. Gingivitis can be prevented by brushing, flossing, and regular dental visits. Periodontitis is severe inflammation of the gums. The gums pull away from the teeth, allowing food to accumulate. The gums become infected, and teeth fall out or need to be removed. Halitosis is bad breath. It's caused by poor oral hygiene that allow bacteria and plaque to build up. Floss is a soft thread for cleaning between the teeth. Flossing helps prevent periodontal disease and cavities. Flossing removes plaque from areas brushing cannot reach. It moves food from between the teeth. The American Dental Association recommends that individuals floss at least once per day. Unconscious persons cannot eat or drink. Some breathe with their mouths open. Many receive oxygen. These factors cause mouth dryness. They also cause crusting on the tongue and mucous membranes. Mouth care should be performed with sponge swabs, like seen in the pictures. The oral hygiene will keep the mouth clean and prevent infections. Unconscious persons cannot swallow. You need to protect them from choking and aspiration. Aspiration is breathing fluid, food, vomit, or an object into the lungs. It can cause pneumonia and death. To prevent aspiration, position the person on the side with the head turned. Use a small amount of fluid to clean the mouth, and do not insert dentures. The care plan will explain what cleaning agent to use and how often care should be performed. It's typically at least every 2 hours. When performing mouth care, keep the person's mouth open with a plastic tongue depressor. Do not use your fingers because the person can bite you. Here are some observations to make when providing mouth care. You want to note if the lips are cracked, dry, bleeding, chapped, or if there are cold sores present. You want to know if there are red, white, or swollen areas, sores, white spots, or bleeding within the tongue, gums, or cheek. You want to note if the teeth are loose, cracked, chipped, broken, discolored, or missing. You want to note bad breath that does not go away with brushing, or a fruity aroma to the breath. You want to note any difficulty swallowing, and report any complaints of mouth pain. A denture is a removable replacement for missing teeth. Complete or full dentures replace the upper and lower teeth. Partial dentures only replace missing teeth. Mouth care is given and the dentures are cleaned as often as natural teeth. A bridge is a mouthpiece that bridges the gap between the resident's real teeth and artificial teeth. Partial dentures are used instead of a bridge to replace 3 or more missing teeth. Here are some guidelines for oral hygiene. Teeth should be brushed after each meal and at bedtime. Floss once per day. Rinse dentures after each meal. Remove dentures at bedtime and soak overnight in a soaking solution. These are some guidelines for mouth care for a toothless patient. You use a foam-tipped applicator moistened with mouthwash or half-strength mouthwash and hydrogen peroxide to clean the gums. You use applicators to clean the tongue, and you rinse the mouth with mouthwash. Even though the teeth are absent, mouth care is still important. Let's review the integumentary system. The skin is the body's natural covering. The skin provides the body's protective covering, prevents microbes and other substances from entering the body, prevents excess water from leaving the body, protects organs from injury, helps regulate body temperature, and stores fat and water. The epidermis is the outer layer of skin. The epidermis contains pigment, which gives skin its color. The epidermis has no blood vessels and few nerve endings. The dermis is the inner layer of skin. The dermis is made up of connective tissue. Blood vessels, nerves, sweat glands, oil glands, and hair roots are found in the dermis. Sweat glands help regulate body temperature. Sebaceous glands or oil glands secrete an oily substance near the hair shafts. This is a picture of the structure of the skin. Daily hygiene. Early morning care is also known as AM care. It's routine care given before breakfast. This is when you prepare the resident for breakfast or early morning activities. You assist with elimination, clean incontinent persons, change wet or soiled linens and garments, assist with washing or bathing, provide oral hygiene, dressing, and hair care, and position the patient for breakfast. This is also the time that you make or straighten rooms. Morning care is care that's given after breakfast. Evening care or PM care is care that's given in the evening at bedtime. With evening care, you'll prepare the resident for sleep, assist with elimination, clean incontinent persons, change wet or soiled linens and garments, assist with washing the face and hand hygiene, assist with oral hygiene, help with changing into sleepwear, Store eyeglasses or contact lenses, and straighten the bed up. Bathing cleans the skin, eliminates body odor, stimulates circulation, improves resident self-esteem, and helps exercise body parts. In hospitals, bathing is common after breakfast. In nursing centers, bathing is usually done before or after breakfast or after the evening meal. The person's choice of bath time is respected when possible. Complete or partial bed baths, tub baths, or showers are given depending on the patient's condition, self-care abilities, and personal choice. Bathing can threaten persons with dementia. It's important to remain calm, patient, and use a soothing voice. There are a couple different types of baths. For a complete bed bath, you wash the person's entire body in bed. Bed baths are usually needed by persons who are unconscious, paralyzed, in casts or traction, or weak from illness or injury. For a towel bath, an oversized towel covers the person from the neck to the feet. The towel is wet with a solution of water and cleaning solution, skin softening, and drying agents. No rinsing is needed. Persons with dementia often respond well to towel baths. Bag baths are commercially prepared. The plastic bag has 8 to 10 washcloths moistened with a cleansing agent. No rinsing is needed. For a partial bath, the face, hands, underarms, feet, and perineal area are washed. Some persons can wash in bed, at the bedside, or at the sink. Partial baths are used on the days that the resident does not get a full shower or bath. Tub baths can make a person feel faint, weak, or tired. A tub bath lasts no longer than 20 minutes. There's some different equipment that can be used in the shower. Some people can stand during the shower. Grab bars are used for support, and showers have slip-resistant surfaces. If not, a bath mat is used. Shower chairs allow the water to drain through an opening. You use the chair to transport the person to and from the shower. Lock the wheels during the shower to prevent the chair from moving. With shower benches, the person is seated for the shower. With shower stalls or cabinets, the person walks into the device or is wheeled to the cabinet in a shower chair, and a handheld nozzle is used for the shower. With a shower trolley, the person has a shower lying down. A handheld nozzle is used for the shower. This is a picture of a shower chair. This is a picture of a type of shower bench. This is a picture of a shower cabinet. And this is a picture of a shower trolley. There are multiple types of skincare products that you may see in a nursing center. Bar soaps are used to clean the skin. They can dry and irritate the skin. It's important to rinse the skin thoroughly to remove all of the soap. It's not needed for every bath, and it's not used for very dry skin. Bath washes and shower gels are used to clean the skin. They're gentler on the skin. They may contain a moisturizer or skin softener. They're liquid, not solid like a bar soap. It's important to rinse the patient thoroughly. No-rinse cleansers are used to clean the skin, control odors, and moisturize. Sprays and foams are common. They are applied to a damp or dry washcloth or to the person's skin. You wash and pat dry. No rinsing is needed. Bath oils are used to keep the skin soft and prevent dry skin. Some soaps have bath oils. Liquid bath oil can be added to bath water. Bath oils can make the showers and tubs very slippery. Creams and lotions are used to protect the skin from the drying effects of the air. They don't feel greasy but leave an oily film on the skin. Lotion is applied to bony areas after bathing to prevent skin breakdown. Lotion is also used for back massages. Powders are used to absorb moisture and prevent friction when skin surfaces rub together. Powders may be applied under the breasts, under the arms, in the groin area, and in between the toes. They are applied in a thin, even layer after drying the skin. Excessive amounts of powders can cause caking and crust that irritate the skin. Deodorants are used to control body odors. They're applied to the underarms. They're not applied to irritated skin, and deodorants do not replace bathing. Antiperspirants are used to reduce the amount of perspiration or sweat. Bariatric patients may need help with personal hygiene. They may not be able to reach body parts or clean under skin folds. Teamwork and planning are often required to bathe bariatric patients. Perineal care or pericare involves cleaning the genital and anal areas. It's very important for persons who have urinary catheters, have had rectal or genital surgery, are menstruating, are incontinent, or are uncircumcised. Pericare is done daily during the bath and also when the area is soiled. It's important to use terms that the person understands, such as private parts, area between the legs. Do not use slang terms. The person does perineal care if they are able. When providing pericare, you work from the front to the back or top to bottom. The urethral area is the cleanest. The anal area is the dirtiest. Clean from the urethra to the anal area. This helps prevent bacteria from spreading from the anal area to the vagina or urinary system. Grooming promotes self-esteem and self-worth. Hair care, shaving, makeup, nail care, and foot care are all components of grooming. It's done to prevent infection and provide comfort. Cultural preferences are important. For both men and women, hair care are matters of personal choice, so is the care of hands and feet. Cultural requirements and preferences influence grooming measures. The patient will perform as many grooming tasks as possible. Hair care is done to improve self-esteem. The look and feel of care affect mental well-being. Hair reflects the person's culture, personal choice, skin and scalp conditions, health history, and self-care ability. Many facilities have a beauty shop for residents. Here are some skin and scalp conditions. Alopecia is hair loss. The hair loss may be complete or partial. Alopecia is caused by heredity. Male pattern baldness occurs with aging. Hair thins in some women with aging. Cancer treatments may cause alopecia in all age groups. Skin disease, stress, poor nutrition, pregnancy, some medication, and hormone changes are other causes. Except for hair loss from aging, the hair usually grows back. Hirsutism is excessive body hair. It can occur in men, women, and children. Causes are heredity and abnormal amounts of male hormones. Dandruff is excessive amounts of dry, white flakes from the scalp. Itching is common. Sometimes a patient's eyebrows and ear canals are involved. Medicated shampoos may be ordered. Pediculosis is infestation with wingless insects that feed on the blood. It's also known as lice. The lice attach their eggs or nits to hair shafts. After hatching, they bite the scalp or skin to feed on the blood. Lice usually spread to others through clothing, head coverings, furniture, beds, towels, bed linens, combs, and brushes. Scabies is a skin disorder caused by the female mite. With scabies, the female mite burrows into the skin and lays eggs. After hatching, the female produces more eggs. Infested with mites, the person has a rash and intense itching. Common sites are between the fingers, the wrists, underarms, thighs, and genital area. Some skin or scalp conditions may alarm you. It is important to remain professional. Report abnormal skin or scalp conditions to the RN. These are just some pictures where you can see in the upper left side is loss of hair. The middle, you can see the nits for the lice. In the upper right side, you can see excessive hair growth. This picture shows a nit on the left, and that's lice, and on the right is scabies. Brushing and combing hair are part of morning and evening care. Some people also brush or comb their hair before meals and before visitors arrive. You want to encourage residents to perform their own hair care. The person will choose how to brush, comb, and style their hair. The CNA will assist as needed. Brushing hair increases blood flow to the scalp. It brings scalp oils along the hair shaft to keep the hair soft and shiny. Report matted or tangled hair to the nurse. Never cut a patient's hair. Shampooing during the shower or tub bath. When you do that, use a handheld nozzles for persons in the shower chairs or taking tub baths. You can shampoo a patient at the sink. That's when the person sits or lies facing away from the sink. A folded towel is placed over the sink edges to protect the neck. The person's head is tilted back over the sink, or a shampoo tray is used. You can also shampoo a patient's hair in bed. With this, the person's head and shoulders are at the edge of the bed if possible. A shampoo basin is placed under the head, and that protects the linens and mattress from water. There's also something called a commercial shampoo cap, and that has a cleaning agent that doesn't need rinsing. Some caps also have a conditioner. In long-term care facility, shampooing is usually done weekly on the person's bath or shower day. The shampoo method depends on the person's condition, safety factors, and personal choice. With shaving, safety razors are electric razors are used. Safety razors have razor blades. They can cause nicks and cuts. Do not use safety razors on persons with healing problems or those taking anticoagulant drugs. Electric shavers are used for those persons. Electric shavers are the safest. They do not require shaving cream or soap. Do not use near a water source or when oxygen is in use. Safety razors are not used for people with wrinkled skin or those with dementia. You always wear gloves while helping a patient shave. Before shaving with a safety or disposable razor, you soften facial hair with a warm, moist cloth. Use shaving cream or soap, and change the blades when they become dull. You dispose of old blades in a biohazard container. Always shave in the same direction that hair grows. You discard disposable razors in a biohazard container. Some female patients will want to be shaved. Follow the same procedures for a male resident. Never shave or trim a mustache or beard without the resident's permission. Nail and foot care prevents infection, injury, and odors. Foot injuries are very serious for older adults with diabetes and vascular disease. Nails are easier to clean and trim right after soaking or bathing. Use nail clippers to cut fingernails. Do not use scissors. Never ever cut a patient's toenails. Makeup is important for self-esteem and a sense of well-being. When applying makeup, you follow the resident's wishes. You encourage independence but assist as required. And many residents also like to wear jewelry during the day. A garment is an item of clothing. An undergarment is an item of clothing that is worn next to the skin, under clothing. Garments are also changed often changed in the morning and at bedtime. Everyone should dress in clean clothes every day. Dressing promotes self-esteem. Cleanliness helps prevent odors. Age, gender, culture, comfort, season, and personal preference affect garment choices. Garments are also changed after bathing, when wet or soiled, and on admission and discharge. Hospital patients wear gowns. Nursing center residents wear street clothes during the day and sleepwear at bedtime. When changing garments, promote personal choice and independence. Dresses that open in the front are easier to put on than ones that open in the back. Clothes should be appropriate for the time of year, temperature, and surroundings. It's important that clothing fit properly. All resident garments should be labeled with the person's name and room number. Report any clothing that needs to be repaired to the supervisor. When dressing and undressing, you remove clothes from the unaffected side first, and then put clean clothing on the affected side first. The affected side is the side of the body with weakness from illness or injury. When helping patients dress or undress, allow them to do as much as possible, as this promotes independence. This is an assistive device for dressing. It's called a button hook. This is another assistive device for dressing. It helps the patient put their socks on. This is a shoe remover. Here are some safety tips for helping patients get dressed and undressed. When dressing the person in bed, you can turn them side to side. Always ensure that the patient is wearing slip-resistant footwear for transfers. Have the person use grab bars for support. Make sure the bed wheels and the wheels of the wheelchair and shower chair are locked. And a gait belt is applied over a patient's clothing. An intravenous therapy gown is used for IV therapy. The gown opens along the sleeves and closes with ties, snaps, or Velcro. A standard gown does not open at the sleeves. For injury or paralysis, you remove the gown from the unaffected side first and put the clean gown on the affected arm first.